Define your world.
Create your wealth. Be a master of your time.
Acquire a skill today.
What if this was your culinary institute? A place to study, a place to experience new words, a place of art. Study cake making and decorating, pastry and cookery art, balloon, ribbon and floral decor. Learn these and more at EKGS Culinary Institute and see the world differently. Locate us at Sakaman behind the A1 Bakery. Call us on 0244 224059 or 0264 224059. Earn a skill today. Do not wait to be employed. Call EKGS Culinary Institute now. EKGS, doing big things with great minds.
One Yogo Yogurt is a probiotic yogurt brand which comes in different flavors with wheat or without wheat, sweetened or sugar-free, and Greek yogurts. They are available in the following outlets: ShopRite, Melcom, Marina Mall, Maxmart, The Farmers Market, Citidia, Boxer Mall, Spa, Options Mart, Shell Shops, Shop and Save, and Tesbury. Contact us on 05460 44523 for bulk purchases and enquiries. One Yogo Yogurt. It's a family affair.
Hey, stop! You little man, just see him go. This baby can run all day long. I wonder what I would do if there were two of him. I am very happy I decided to wait before having another child. Luckily, I met a family planning advisor at a salon who gave me great advice. I also claimed the Advantage Secure gifts. Now I can space the birth of my children as I want. With Secure, I decide.
This advertisement has been vetted and approved by the FDA.
Welcome to Elite Mother Care. At Elite Mother Care, we do retail and wholesale of only special and beautiful products and clothing for expectant mothers and children from 0 to 18 years. We sell baby essentials like changing bag, baby carrier, changing mat, Macintosh, baby wrapper, feeding bottles, nappy liner, and more. And to you expectant mothers, avoid the stress. Bring your hospital list for baby and mama. For all your sanitary pad, disinfectant, toiletries, take-home dresses, all in one special pack at an amazingly affordable price. Locate Elite Mother Care at Okanshi Accra Central near the GCB Bank, White Angels, or at Makola adjacent the Old White Chapel. At Bobulushi 5, New Market 45C. Call Elite Mother Care on 056 134 9044 0266 236670 056 134 9044 027 918 9593. May your newfound happiness make your heart bloom with joy. Elite Mother Care.
I welcome you to Every Woman Chat Show right here on Sunny 88.7 FM. Good afternoon and thanks for being a part of this show. As we move along in today's conversation, you can send in your thoughts and your contributions. My name is Afiba Dansah-Appiah, your host for today, and today we'll be discussing healthy tips for women. A huge thank you to our sponsors, Elaine Mother Care, One Yogo Yogurt, to our media partners, Sunny FM, Secure, and EKGS. We are live on Facebook at Every Woman Chat Show and on Sunny 88.7 FM. Please like our pages and share this link for others to also benefit from today's discussion. We have the ever beautiful Dr. Rosemona Boaje here. She's our special guest for today. She's a radiologist and with Rand Medical Imaging and Health System, and also at Greater Accra Regional Hospital. Happy New Year to you, Doc.
Thank you. Same to you and to our listeners and viewers on Facebook. Yes, I'm happy to be here.
It's been a while.
Yeah.
You look so good.
Thank you. You look awesome.
Is it that the beauty is beauty or?
No, the beauty is beauty. Grace is abounding.
We give glory to God. So, Doc, there are so many misconceptions about women's health. So today, as you are here, you're going to help us clarify some of the issues that we have, and then give us practical examples as to how we are going to go about our daily needs as women. So first of all, why the importance of maintaining good health?
So thank you very much. As human beings, we are just two categories. We are either alive or dead. And if you are fortunate to be alive like we are, your most valuable asset is your health. It is not your children, it is not your property, it is not your husband or wife. It is your health. And as women, per our role in society, you can be a doctor, a judge, whatever role you play in professional life. When you come home, you are a caregiver. And so we give of ourselves at work, we give of ourselves in the home. And the demand on us as women is usually higher than it is for the men. Just before I came in, my daughter called me from school and she gave me a long list of items I should bring when I'm coming to visit her next week. And so everywhere we turn, there's a lot of demand on us. And a lot of the time we forget to take care of ourselves, and we spend on other people and we ignore ourselves. If you are not healthy, you cannot take care of your children. If you fall sick today, you can't go to work.
Absolutely.
You cannot be a good wife, you know. So for everything that we hold dear, everything that we are running around for, if we don't have good health, everything comes to a standstill. And so we need to be deliberate and intentional about our health. You want to be a mother for longer, you want to be a wife for longer, you want to be a doctor, whatever role you are playing in society. This thing that I'm doing, I want to do it till I'm in my 80s. And if I don't have good health, I'll not be able to sit here.
You can't.
Yes, and so the importance of our health, we can never overemphasize it. And when we talk about health, I would even exaggerate WHO's definition and add that it is not just the absence of disease, but physical, emotional, psychological well-being. And so it is not just about you being physically sick, but your mental health, your emotional health, all those things, they play an integral part in deciding whether you are healthy or not.
Whilst I was reading about this topic, I even chanced on having a healthy skin as well. So even our skin with
your skin is like a mirror. And if you are not well, there are a lot of systemic diseases that would show on your skin. And your skin is your largest organ. It is an organ. And so the importance of taking care of your skin alone, it cannot be overemphasized. If there is a problem with your skin, it affects a lot. Even if you have a little rash, it affects your confidence. For those of us who have acne and then you have black spots, it affects the way your confidence level. And so every part of us is important. And we need to take the time to take care of ourselves.
So, what are some of the age-specific health considerations that every woman should work on or be aware of?
Yes, thank you very much. So, as women, I'll start from, let's say, the early teens. So, now our girls start menstruating from as early as 9 years, maybe even earlier. And so, from that age, when they enter into puberty, the common things that mothers or young girls would encounter are problems with menstruation. Some of these girls have painful menses. Some of them are not able to take very good care of themselves, so they end up with vaginal infections and bad odor. And sometimes some of them are not well counseled, so they stray into sexual activities. So they now have problems with sexually transmitted infections, unwanted pregnancies, and then sometimes they try to, terminate, and then you have complications of abortions.
So the training is not enough.
Well, sometimes we try hard, but no matter how hard you try, you still have a few stray bullets. You do your best, but they still. So we need to talk to our children, and we need to build that confidence so that they know that even if they stray and they make a mistake, they shouldn't go ahead and make another mistake. They should be able to come to us as mothers or as healthcare workers and confide in us that my mom told me not to sleep around and I have, and now I'm pregnant, so that we can guide them properly as to how to manage those crises. So for the very young ones between the ages of 9 to like 20, these are the major issues: problems with menstruation, sexual health, and then unwanted pregnancies. And then for those of us who are in the more vibrant, sexually active marriage.
Let me chip this in before you move on. I mean, you mentioned the ages between 9 and to 20 years.
Yeah, late teens.
Would you advise, I mean, if they're in their puberty stage, would you advise contraceptives for them?
Well, the truth of the matter is that most
Since
children...
you're talking to them about sex and all that.
Yes, most children or girls that age, we do not expect that they will be sexually active, especially in the clinic, Christian perspective. But the truth of the matter is that they are having sex anyway. And so if they are, you might as well teach them about contraception. You should, because if they are not using contraception, they will get pregnant. Some of them will try to terminate it and they will not do it right and may end up losing their life in the process. Some of them will get pregnant, they will have children, and they will never be able to. Some people are able to bounce back and go back to school, but there are a lot of girls who never get that confidence to go back into mainstream education again. And so you just get that life wasted. So once we know that they are sexually active, I'm strongly of the view that we should teach them about contraception.
Okay.
And negotiation skills, you know.
All right. So please, you can go ahead with
Yeah, thank you. So for a vast majority of us who are either married or very sexually active in our reproductive bracket, having children, some of the things we deal with a lot are pregnancy-related issues, pregnancy and childbirth. So in pregnancy, there are a few complications that we need to be aware of. For example, if you are pregnant, at no point in pregnancy should you bleed. So if you are pregnant and you are bleeding, then there is a problem and you need to seek help. Sometimes you lose a pregnancy, and when you lose an early pregnancy, you may need to go to the hospital because sometimes all of it does not come out. And if you stay home, it becomes infected, and then you have what you call septic abortion. That can even cause you to lose your life. Yeah. Yes. Sometimes when you are pregnant, you have problems with diabetes, hypertension. So really, for every woman who gets pregnant, it is so important that you go to antenatal. Antenatal is not routine. We think it's routine, but there are a lot of things we check. We monitor blood pressure, we look at blood sugar, what substances are in your urine, how well the baby is growing. So any and all the complications that can arise in pregnancy, once you are consistently going, you are being taught about the danger signs in pregnancy. So once you see them, you know that I need to go and talk to my gynecologist about it. So when you are pregnant, you really, really need to take your antenatal seriously and to listen to what you are being taught, so that when there's a danger sign, you can report immediately. For example, some people with high blood pressure and pregnancy, they can go on to have what they call eclampsia or preeclampsia. So there are symptoms, very bad pitting edema, their feet will swell, sometimes they have seizures, and you need to know all these things so that once you see it happening, you know that then yes, you quickly have to rush to hospital. And then also in this very active, sexually active bracket, infections, sexually transmitted infections, they are one of the major things that bother us. When you have a sexually transmitted infection, you need to see your doctor. We need to identify the kind you are suffering from and then give you appropriate antibiotics. Sometimes people are shy because it's down there, so they'll talk to their friend, and then your friend will tell you, the last time I went, they gave me this one. So, but there are lots of different types of infections. So until you come to us, maybe what you are treating is not the right way to treat. And when you have an infection that becomes chronic, you know, sometimes it's just a vaginal infection, but because you are not treating it well, it climbs up, affects your uterus, your fallopian tube, you get a PID, your pelvic inflammatory disease. At that point, it can block your tubes. So you are not just fighting an infection now, you are fighting infertility because your tubes get blocked. So really, things start at small, but if you don't nip them in the bud, the consequences are far-reaching.
Can it become cancerous at a point?
Well, there's no direct evidence that infection can lead to cancer, but there are some of the viral infections that affect the cervix that have been proven to cause cervical cancer. So even in your when you are in your reproductive age, now in most countries you take vaccinations to protect you against cervical cancer. And so when you do your Well Woman Clinic, all these things are discussed. And if you are sexually active, then at a very young age, you really need to start having your pap smear. In the sexually active age group, pap smear every 3 years. You should have a pap smear. Once you have one and it's normal, every 3 years, you should have one. And then also sometimes you have infection, not sexually transmitted, but urinary tract infections. It's very common. If you have sex quite often, the mucosa or the lining of the tube where the urine passes, it can become bruised. And when it does, it is easy for bacteria to climb up. It can affect your bladder, your ureters, your kidneys. That's why we have something called honeymoon societies. If you marry and you go for honeymoon, you have a lot of sex. A lot of people come down with UTI, urinary tract infections, because there's a lot of bruising along the tract there. So once you are sexually active, you can't get urinary tract infections, and you need to treat it appropriately. If you don't treat it, it will climb from the bladder, it will affect your kidneys, and there are very dire consequences of complicated urinary tract infections. Should I continue?
Now, I would want you to touch on menopause.
Okay.
What our women needs to do around that.
Yeah, I'll talk about menopause. But one last thing, vaginal odor. It is a very common problem, and usually in women who are in between 15 to 45, 50 before menopause, it's a major problem. So maybe later on I'll talk a little more about it. For women in their menopause, one of the common things that we face, the symptoms of menopause, they are anxious, they have vaginal dryness, sex is painful for them, they have mood swings. So for things like the painful sex, we have various lubricants that you can use to make sex less painful for you. There are hormone therapy that your gynecologist can recommend for you to help you manage some of the symptoms. Sometimes they are giving antidepressants. Some of them have mood swings. It becomes very difficult to live with them. Sometimes you may need to speak to a clinical psychologist. When you are in your menopause, your bone density also goes down, so you may need to take supplements with vitamin D and calcium, to help maintain your bone health. Yes, those are some of the common problems in menopause. Sometimes they have difficulty sleeping. It's not every symptom of menopause that needs to be treated, but you need to know about them. You need to understand why you are having those problems, and where you need help, your gynecologist can come in.
So it can be managed.
Yes, we manage it. You cannot cure it, but you learn to manage it or to live with it.
All right, you mentioned cervical cancer. The month of January is cervical cancer awareness. So every woman chat show, CS Foundation projects, we are just admonishing you as we go along in this discussion. After the commercial break, I'll speak more on that. We are saying that get informed, get screened, get vaccinated. Every cervical cancer detection can be treated. And our sponsors are Sunny FM and then Yaz FM. So after the commercial break, we will speak more on that, and you will know where you can go for the free screening as well. So Doc, what are some of the healthy tips? Let's go there for every woman.
Yeah, before I come to that, so with the postmenopausal women, even for women in very active reproductive years, we need to be mindful of breast cancer and cervical cancer. So as part of your Well Woman appointment every year, every 2 years, you need to screen for cervical cancer. You need to screen for breast cancer. In the past, we used to say that it's more common in the older women after 40 or 50. But the cancers now, they haven't read the textbooks. We are seeing cervical and breast cancer in women in their 20s, women in their 30s. And so as young as 20 years, 30 years, you need to start having your pap. So long as you are sexually active, you need to start having your pap smear. You need to do your ultrasound or mammogram, depending on your age, every year, every 2 years. And particularly if you have a family history, you should not joke with it. Apart from that, there are other cancers which come with symptoms. And so once there's something going on, for example, if you are postmenopausal, you should not bleed. You shouldn't have vaginal bleeding. Once you've not been able to have a period for a year, the blood should not come again. So once you see blood, you need to see your doctor. You need to find out whether you have cervical cancer, endometrial cancer, vaginal cancer. So every symptom that is abnormal, speak to your doctor about it. Let him decide that it is of no concern before he decide that he wouldn't do anything about it. So for the common
healthy tips,
yes. So one of the things that I talk to men a lot, both men and women, and one of the things that men have been concerned about and talked about is vagina. Even women, vagina odor. The vagina is not supposed to smell like nothing. It has a smell, but there's a smell for a healthy vagina and a smell for one that is in trouble. And the best way to know that the smell is off is to know what your normal vagina smells like. And once you realize that, are the men listening? Once you realize that the scent has changed, you need to identify what has changed. Commonly, it is infections. You have a vaginal infection that has not been treated at all or not been treated well. Sometimes it is just because of bad personal hygiene. You need to bath well and often. When you sweat a lot, the pubic hair traps sweat, and there are a lot of natural body secretions that come out of the vagina. So if you are not bathing regularly, it begins to smell. And depending on the time
so you're saying it should be trimmed every time?
Well, no, that one is a great area. There are some men and women who like the hair. So if you are in that category and you like hair, then you need to take extra care of your pubic area. I even recommend that you get a small towel. When you bath, you put mild soap in it and actually scrub your vulva. You don't need to clean the inside of your vagina. That one, God has put a lot of measures in place to clean it. You need to clean the vulva, the external part, and leave it alone. So that brings me to douching. It's a no-no. It's a no-no. It's a no-no. If you have an infection in your vagina, you need to treat it. But if you don't have an infection, you don't need to douche. The body cleans the vagina by itself. Your job is to clean the outer part, the vulva.
Doc, I've heard this precursor, is it precursor? Pepper and
yes, I've heard it. I've even heard ginger, garlic, all kinds of concoctions. I've heard them, and there are some even in pharmacies. But the truth of the matter is that if you don't have a vaginal infection, or you have it and you've treated, you don't need to put anything in your vagina. You don't need to. Well, I haven't used a feminine product before, and I don't think I smell bad. You don't need it. Naturally, God has made provision. If you keep doing that, we have harmful bacteria and good bacteria in the vagina. We have bacteria everywhere, your mouth everywhere. So the vagina is a jungle down there, and there are harmful and good ones. God has made a perfect blend of the two. But once you introduce external elements, now you change the flora. We call it the bacteria, we call them normal flora. Then you have more of the harmful rather than the good ones. And that is when you start having problems. And so it is better to leave it alone. If you started, it is not too late to stop. Okay, some people say they do that to make the vagina tight. If you want your vagina to be tight, do your Kegels exercise. You know when you feel like urinating and you don't have a loo, the way you hold it. Yes, that is basically Kegels. So once you do your Kegels exercises often, all the time, that place is tight and sweet. You are having your regular exercises and your diet as well. If you eat food that are quite
ask you about unhealthy foods.
Yes, so they are not unhealthy per se, but because of they are very pungent, like garlic, onions. If you eat a lot of those, it affects the smell down there. It makes the smell a bit more stronger. If you eat foods like pineapple gives your down there very nice smell. So if you want it to smell nice, you should eat a lot of pineapple, a lot of fruits and vegetables. You should drink a lot of water. When you drink a lot of water, it flushes everything out of your system, including the down there. So your hydration status, depending on the time of the cycle, just after your period, usually you have a little bit of blood still there, so the smell is different. But you know that it is just because it's a day or two after your period. After that, it goes back to normal. So you need to know your body, how it changes with menstruation, how it changes with your diet. And then the panties we wear, cotton panties are good for us. They make the vagina breathe. They are able to absorb the secretions that are coming out. So I would recommend cotton panties any day. The silk and the satin ones, they are nice, but you use them for show.
Doc, talk about how many times you need to change your panties. You know, as you are talking like this, somebody might be wearing one like morning till evening, not changing it. I mean, wearing it the floor. You have no idea. It's not only the men that do that.
No, you shouldn't take your pants off and then wear it again. It's when you take it off, you have to wear a new one. You have to wear a new one. You can't wear one in the morning bath and wear it. No. In fact, if I even recommend that at night, if you are not menstruating and you are going to bed, just go to bed, do anti-pain, let the thing breathe, ventilation. Even if you are not married, it is good. But if you are married, to leave the place open so that in case there is a match at night and you are feeling now, there will
be some struggles.
No. So if you can at night, don't wear pants. If you really like the silky one, I'll come to your question. You like the silky one, the satin ones, those ones is for show. So you one mini match be then you put it on and you cry and very soon it comes off. Those ones you wear it for like an hour or two and then it comes off. But for everyday panties, cotton is the best. And then we shouldn't wear very tight clothes. I'm wearing jeans, but if you are wearing it all the time, the plate doesn't breathe. The sweat is there, everything coming out is stuck there. So you need to wear clothes that make you breathe, your pelvic area. So, some loose fitting clothes, And so for the panty, you shouldn't take it off and wear it again. If you are having a lot of discharge, every woman, every vagina discharges. It is normal. It is part of how God made us. And depending on the time of cycle, the discharge may be very small, sometimes a little bit copious, but it should never be so much so that you cannot handle it with a simple panty liner. If your discharge is so much so that the panty liner is not enough, you actually soil yourself, then it is too much. You need to see your doctor. Your discharge should be either clear, like the white of an unboiled egg, a fresh egg, how that white is, or it should be white like milk, or just off-white. Any other color, you should be worried. Green, yellow, blood stain, all those kinds of discharges are not good, and you should see your doctor. If the discharge causes irritation, it makes the place sour, it makes you irritable, you are itching. Any kind of discharge that comes with those kinds of symptoms, you should be worried about an infection. You should see your doctor. And when you are cleaning your butt after, easing yourself, you should clean from the front backwards, not from the back to the front. Or if you do from the back to the front, there's a lot of bacteria and fecal matter, so it can come into your vulva area, enter into your urethra, and then cause urinary tract infections. And for our little ones, very small girls tend to get UTIs as well, and mostly it is because of bad or poor personal hygiene. So we need to teach our girls very early how to clean themselves. I've seen a lot of young children, UTI, you open the vulva and the whole place has this creamish and it is all over the place. So we really need to teach them how to clean very well. And if we clean very well, then we eliminate a lot of the risk for these infections.
Gifts. Now I can space the birth of my children as I want. With Secure, I decide.
This advertisement has been vetted and approved by the FDA.
Own your world.
Create your wealth. Be a master of your time.
Acquire a skill today.
What if this was your culinary institute? A place to study, a place to experience new words, a place of art.
Thanks for staying with us. You are listening to Sunny 88.7 FM, and this is Every Woman Chat Show. We've been discussing healthy tips in women with Dr. Rosemond Aboagye of Rand Medical Imaging. And let me take this message from Medical Women Association of Ghana in collaboration with Yaz, Sunny FM, and Every Woman Chat Show. We are offering free cervical cancer screening on the 26th of January. Time is 7 a.m. And then the first 100 people can see of these people, you're having a free screening, free for them. The first 100 people, it's free for them, but the subsequent ones will be 50 Ghana cedis, and then they have pap smear, which is 150 Ghana cedis. So please take advantage of this, and it will be held at Kwelebu Polyclinic Family Medicine Department. Kwelebu Polyclinic Family Medicine Department. First 100 people to get there, you will have it free of charge. EKGS Culinary Institute, Ghana's most preferred culinary institute, they are providing professional training in cake making and decorating, sugar crafts 3 to 4 months, pastry and beverages are 2 to 3 months, cookery arts mainstream 6 weeks to 2 months, and then they are in partnership with Wilton USA. They are providing short courses in the American style of cake making and decorating for beginners. So you can enroll in these programs, and you can reach them on 0244 224059, 0264 224059, or you can also call them on 0302 307293. Visit their website www.ekgsghana.com. So please go get yourself enrolled in this. The number to call is 0540130684, 0540130684, or you can send a WhatsApp message on 0264 663 0264 663 663. Ask all your questions, or if you have any contributions, you can do that. And also on Facebook, we are live. Send in your questions as well. Let me see if we have some messages rolling in on our Facebook page. Okay, we have Eunice Auntie watching. Thanks for watching, and all those that are watching. To Reverend Michael Dansah-Appiah, thank you so much for always holding us back. Doc, to our topic, healthy tips for women, our food intake. I want you to tell us how we should go about it.
Yeah, so thank you very much. God being so good, the basic things about healthy eating, they apply to, to everything else. We need to take in a lot of fruits and vegetables. I think that Ghanaians, you don't like that very much, but fruits and vegetables are good for us. We need to reduce how much starch we are taking in carbohydrates. So the kenke, the fufu, the ampesie, we need to reduce the quantities, the volumes, and then eat more of salad, eat more of fish. You should choose fish over meat. You should choose lean meat over meat with fat in it. You should choose grilled over fried, and you should avoid sugar. I mean, every once in a while, I have a sweet tooth. Every once in a while, you can have a bit of sinful delight. But really, we should be avoiding as much sugar as we can. Anything with refined sugar in it is not good for you, so you should take it as little as possible. The oils, we should cut down our oils, except of course the good ones like the omega-3. We should be exercising. Myself nowadays, I'm just so hard pressed for time. But every chance we get, we should exercise. In addition to our food, we should drink a lot of water. So I carry a bottle of water with me everywhere I go. Hydration really is so good for us. It even helps with your skin. Yes, so the more water you drink, the healthier your skin looks. So drink a lot of water, exercise, eat fruits and vegetables, cut down your salt intake, your fats intake, your dairy intake, your sugar, refined sugars. And if we adhere to these basic things, it should go a long way to help us. And then eating late. Sometimes per the nature of your job, it's difficult to avoid. But if you come home late and you are that hungry, that is not the time to eat rice or fufu. You can take a light snack. After 7, your body really wouldn't need a lot of energy. So if you take in energy-dense food, it's all going to convert to fat, and it will be sitting in the areas you don't want, increasing your risk of diabetes, hypertension. So really, we need to watch what we eat, the time we eat them, and then do well to exercise. And one other thing that sometimes we don't talk about often, you mentioned is stress.
Before we go on stress, the phone line to call is 0540130684. 0540130684. If you have any questions or any contributions to make on this discussion, 0540130684. We have some messages on Facebook. Collins Ose Quantin, he says awesome health education. Victoria Domingue, I don't know if I've pronounced it well. She's giving us a thumbs up and then laughing. I don't know if that one had to do with when you were talking about the vagina stuff. I'm sure it's about that one. Thank you to all those that are watching online.
The vagina is a very expensive real estate. You should take good care of it.
Okay, Doc. So on stress management.
Yes, so
stress management.
Over the years, research has proven that a lot of some of the chronic conditions that women face is directly linked to stress. Some of the cancers, depression, anxiety, they are all related to stress. Stress is good if it is acute, but anytime you have chronic stress in your life, it really can affect your health, your mood, your output in life. And so we should manage stress. And I think I should say this here, the men would need me to say this. For women, one of our biggest stress releases is sex. And I know that a lot of women are not having enough sex. They are not doing it the right way. They see it as a chore. So when the man calls, then they are giving excuses. Please, you need to release stress, and sex is one of the best ways to release stress. So if you are not if you are running away from it, it means that you are not enjoying it. You are enjoying, then that means you are not doing it the right way. Because if you are doing it the right way, you will enjoy it. You'll be happy to do it. You say, brah, you will run and come. So really, I think that sex is a tool that we are not using as women. So for every woman out there listening to me, if you are not having enough sex, you are not enjoying sex, then you are denying yourself of a very important stress reliever. So find ways to learn how to do it better, to do it well, and to do it often. When you have good sex, you release hormones that make you relax. They make you have a better, like you feel good about yourself. You are happier. Even your skin, like you glow. I'm sure the men are very happy. So please, that's for the women. That's for this one. I beg you.
So, Doc, I want you to hit on it should be for married couple, right? The sex.
Okay, well, yeah. Well, for anybody, yes, of course. I mean, that is what it should be. But for anybody having any kind of sex, please make sure that you are satisfying your husband and satisfying yourself. If you are not doing it enough, please find out why you are not enjoying it. Make time for it, enjoy it, get the best out of it. Even God approves it. And recently, I even heard that the Pope was approving it.
Really?
Yes, somebody showed me. I don't know how I got to know that.
I think you should show it to me. I've not seen that one.
Yeah, I would forward it to you. So the benefits of sex really in releasing stress cannot be overemphasized. Sometimes you need to let other people do some of the things for you so that you can rest. If you need help, ask for it. And if the people around you offer to help you, let them help you. Some of us, I'm busy, but even somebody wants to help you, you don't need to do it by yourself. Anything that you don't need to do by yourself. If you can pay somebody to do it, you can afford to pay somebody to do it. If somebody offers to help you, say thank you and accept the help. Sometimes you may need to partner with your friends. One time you take care of your friend's kid for a weekend, and then the other time your friend also takes your kid. Any chance you get to take some work or burden off you, you should take that opportunity.
So we want to play the superwoman.
No, you can't be a superwoman. If you're a superwoman, you break down at a point, and you need to be alive for the long haul. You need to be alive to see your children graduate. You need to see them get married. You need to see your grandchildren. The purpose and work that God has given us, it is not a sprint. It is a marathon. And so you need to really take good care of yourself so that you can live very long. Some time ago, one of my children was asking me that, Mommy, why do you always go for walks in the morning? when I used to be more disciplined. And I told them that I need to be alive when you are getting married, when you are having your children. I need to be there long enough.
Yeah, to celebrate them.
Yes, we need to live long enough to spend more time with the people we love. Okay, so if your work is very stressful, sometimes have dedicated times. You take a day off or half day off. Just be by yourself, catch up with yourself, meditate, read the word of God, do breathing exercises, anything but what you normally do. Just take the time off and then catch up with yourself. And if you do that often, regularly, your stress levels will come down.
Okay, the number to call is 0540130684. 0540130684. Send your questions and thoughts coming in. Doc, is it good to be taking in supplements, multivitamin supplements?
Well, it depends. For me, people my age, younger women, I would always tell them that if you are eating well, you are taking enough fruits, vegetables, then you probably do not need to take in supplement. But there are people who are not eating very well, or by virtue of some chronic condition they have, they may need to take in supplement. At a certain age, you may need to take in some supplement, calcium, vitamin D. Yes, but there's nothing like the real thing. So if you can eat your fruits and vegetables very well, you don't need to take a multivitamin tablet. But if you're having problem eating, or where you are, you don't get fresh supply, and you need to take supplement, then that is okay. But sometimes people overdo it. They are taking like 4 or 5 supplements at a time. Your liver, you're overworking your liver, and you're also going to create problems. So there should be a fine balance, you know. If you don't need to take medicine, don't take it.
The last thing I want us to talk about before our time is up, I want us to talk about setting boundaries for ourselves. Setting boundaries as women, how we should go about it.
Well, so boundaries come in different forms and different aspects of life, but if you are there and you haven't set any boundaries, then you are open to anything, not just in terms of protecting your health, but every aspect of your life. If you don't set boundaries, people would practically plan your life for you. So in relation to health, for example, you should have some boundaries. You should decide that, okay, I need to sleep this number of hours every day. That is what is good for me. Sometimes when it gets to a certain, no matter how much work I have, I just put my laptop off and then I sleep, because I know I need to get a certain number of hours of sleep. Sometimes I get called, people call me, I want you to do this for me, I want you to join this community, I want you to do that. But when I look at how much work I have on my table, I realize that it would be nice to join this, but it will not be good for me. And so you need to learn to be able to prioritize and to say no. So what you can't do, you think is too much for you, politely decline. If you can recommend somebody else, you recommend that person. And then you can also go through your everyday routine. Are there things that you are doing that somebody else can do? Delegation. You can sweep what you do and then delegate some of the things for other people to do. You should have protected time with your spouse, your loved ones, so you can decide that, okay, Saturday evenings from this time to this time, it is not for work, it is not for anything, it is not for church, it is for me and my husband, or for me and my children, and nothing comes in the way of that. You read, you watch movies, you crack jokes, you do your exercise. So you should be deliberate about the things that improve your health and well-being. If it is gardening you like, set some time aside within the week, do gardening. If it is dancing, you should have time for those things. They are the ones that charge your batteries. And if you go for a long time without charging your batteries, you burn out. And so really, boundaries are very important, even in how you spend your money. And me, if I don't have money, I'm sick. So I think money is directly related to my health.
Okay, Doc, your last words before we go.
Yes, so to every woman out there, our health is our biggest and most important asset. So as you have entered this new year, everything that you need to do to ensure that you are safeguarding your health, you should do it, even if it has to cost you money. even if it has to cost you friends, whatever it costs. It is so important that it is not too expensive if you have to pay for it. Whatever way you have to pay for it, to